Good afternoon, and thanks for joining us for Living Local, your lifestyle show for everything Charleston and beyond. I'm Ashley Meservey. It's Medical Monday here at East Cooper Medical Center, and today we're discussing joint preservation, a process for which focuses more on repairing the damaged area to avoid more invasive surgical procedures.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us once again today is Dr. Brodie McKoy. Thanks for being back with us today.
Well, excited to be here. Thanks for having me.
All right. Today's topic is joint preservation surgery. What is that?
Sure. That's it's a group of surgeries that we do, whether it be knee, shoulder, or hip, where we try to preserve the native cartilage that God put in your joints prior to doing something more invasive like a joint replacement. There's sometimes when people will need a joint replacement when the cartilage is completely destroyed and there's no other option, and that's what we have to go to, and it's very successful. But what we found is that in a lot of diagnoses and a lot of circumstances, we can do something short of that, less invasive as an outpatient, to try to help bring pain relief and preserve the native cartilage that's in there. Because even the best metal and plastic that we put in there when somebody has a knee or hip replacement still has a limited lifespan to that material itself. There's no better material than what God put in there, the cartilage itself. I mean, nothing's been able to replicate that. All the studies we've done, all the materials we've tested. So what we want to do is there are certain patients and certain diagnoses where people will benefit from just addressing the damaged portion of the joint and not interfering with the other part of the joint.
So I've had back surgery and I have my disc that was bulging, and so they went in and just kind of cleaned it up. Is that kind of the
same, just
kind of going in there and
just that's right. So it'd be similar to that. Let me just give you an example. So like in the knee, so there are areas of the knee. Let me just show this model right here, where if the damage is localized only to one area, for instance, where that dark area is right there, we can come and I can transfer some cartilage from up here. I can borrow from Peter to pay Paul, if you will. Take a little bit of cartilage that's on a non-articular surface, move it down there and implant it. I can even transfer, like cadaveric tissue that's in there, like if people have a kidney transplant or.
So you can get it from other parts of your body?
Other parts of your body, or from or from a cadaver as well. So there are other options you can do like that. So it's treating just an isolated area instead of having the entire knee replaced. We just address the area that's damaged. A big area is in the hip. I do a lot of hip arthroscopy. So where I take a scope and I go inside your hip. There are areas of the hip that can be torn, like a labral tear that I can repair, via a camera, or areas of the cartilage that we can do something called microfracture, where actually if you got a defect in the cartilage, I can make some little small holes in that defect, and the mesenchymal cells, kind of the stem cells, if you will, of your body, will come in and fill that defect. And we've had really good success with it, very successful. You can do it in the shoulder as well. It's done as an outpatient surgery. I think people long-term have much better outcomes if you can treat the condition with these surgeries.
So if you were to do, let's say, a normal hip replacement surgery and you did this, how quickly do they recover?
So hips do extremely well just across the board, just to say that. I mean, hip replacement surgeries usually stay one night in the hospital, go home the next day. Can be done as an outpatient as well. Hip arthroscopy is done all as an outpatient. It takes about an hour to do it, come in, have it done, and go home the same day.
Perfect. All right. Well, Dr. McKoy, thanks again
for being
with us. And you can go online and learn more about this and more at eastcoopermedctr.com.